not able to sense the vibration, it may be a sign of posterior column disease or peripheral neuropathy, as seen with people with diabetes or chronic alcohol abuse. Alright, so now the next test that we're going to be doing is we're going to test the sensitivity to position. We're going to have the client close both eyes, then hold the client's toes or fingers on the lateral side and move it up and down. And then we're going to ask the client to tell you the direction it is being moved. Alright, so I'm gonna touch the finger, hold the finger, and then tell me which side it's going to be moved, okay? So which side am I moving?
Left.
And,
Right.
okay.
Right. Left.
Okay. So you basically repeat the same thing with the toes. And we want the client to, again, be able to identify the direction, the correct direction, which my patient did. The next thing that we're going to look at is we're going to assess the tactile discrimination, the sterognosis, and the way you do this is we're going to have the client, again, close both eyes, and then I'm going to place an object in the client's hand, and the client should be able to tell me what the object is. Okay, so can you close your eyes for me? And I'm going to place an object in the client's hand, and the client is going to tell me what it is without the eyes, without opening the eyes. Can you tell me what this is?
That's a lock.
Okay, so that is correct. That is a lock. So she passes the sterognosis test. The next thing is we're gonna do the tactile discrimination. We're gonna assess the tactile discrimination and test for graphesthesia, I think. So again, client's eyes gonna be closed, and I'm gonna draw something on the client's palm, and they are supposed to tell me correctly what it is that I'm drawing. So, can you close your eyes for me? Perfect. And I'm gonna draw something on your hand, your palm, and you tell me what it is.
4.
Okay, that is correct. So that test again, she passed that test. All right, so that concludes the sensory portion of my assessment, and the last is the reflexes. We're going to be doing the reflex, and the first reflex that we're going to check is the bicep reflex, and what we need is, which I don't have, but we need to have a, let's see, we need a reflex hammer, and we're going to ask the client to partially bend the arm at the elbow with the palm up and place your thumb under the bicep tendons and strike your thumb with the reflex hammer. And then we're going to repeat it on both sides. What we want is the elbow reflexes, and for the elbow to reflex and contract at the bicep muscle. So elbow reflexes and contraction of the biceps muscle is seen or felt. Ranges should be from +1 to +3, and the forearm flexes and supinates ranging from +1 to +3. If there's no response, or if the response is exaggerated, then that is normal. So that is abnormal. So again, we're We're gonna hold the client's arm like this. Oh, sorry. Wait. Let me do it. So like this, sorry. Okay, so we're gonna hold the client's arm like this. And this is gonna be my reflex hammer. And what I'm gonna do is I'm gonna hit my finger with the reflex hammer. And the response should be the elbow flexes and contracts at the bicep. Okay. The next thing that we're going to do is the brachioradialis reflex function, and the way that we do that is similar to the bicep reflex. So we're going to hold the patient's hand like this, and let's see. Alright, so we're going to hold the patient's hand like this, and we're going to hit the patient's hand right here. So what we want is, again, the contraction of the patient's hand, and it did. Again, a no response or exaggeration is abnormal. We want a contraction of the okay, so we did experience contraction when we hit the brachioradialis, and which is what we wanted. A no response or exaggeration would be abnormal. Okay, now the next thing that we're going to look at is the tricep reflex, and the way we're going to have the patient hold their arm like this. We're going to hold the patient's arm up like this, and we're going to hit the we're going to ask the client to hang the arm freely while you support it with your non-dominant hand. With the elbow flex, use the flat side of the reflex hammer to tap the tendon above the olecranon process. Repeat on the other side. What we want is knee extends, quadricep muscle contract at a range of +1 to +3. So we're gonna again hold the client arm up like this, and then we're gonna use the reflex hammer. Okay. So I got a slight contraction, movement when I hit her olecranon process, which is what we want. We want the muscle to contract. Then the next